Welcome to Elimination Diarrhea and Constipation Training for the LPN from Wyoming State Hospital. Regular elimination of bowel waste products is essential for normal body functioning. Alterations in bowel elimination are often early signs of symptoms of problems within either the GI or other body systems. Because bowel function depends on the balance of several factors, elimination patterns and habits vary among individuals. Understanding normal bowel elimination and factors that promote, impede, or cause alterations in elimination help the nurse to manage patients' elimination problems. Supportive nursing care respects the patient's privacy and emotional needs. Measures designed to promote normal elimination also need to minimize discomfort and embarrassment to the patient. Our objectives for this training include, for diarrhea, we're going to evaluate for causes of diarrhea, report liquid stool or increased frequency of stool to the RN, who will report it to the LIP, evaluation for dehydration, monitor intake and output as indicated, encourage intake of 2,000 to 3,000 cc's of fluid a day, and unless not contraindicated, and provide prescribed medications as appropriate. Discuss and mutually plan needs for changes in usual activity level with the interdisciplinary team. For constipation, report decrease in frequency or absence of bowel movement. Auscultate for bowel sounds, monitor and record patients' bowel movements, review patients' normal bowel habits, time of day, stimulus with coffee, etc., and provide for privacy. Provide optimal environment. Utilize the bathroom or commode, feet resting on the floor with thighs flexed. Use the footstool if necessary, and elevate the head of the bed to high Fowlers as permitted if using the bedpan. Establish regular time for elimination, identify patient's normal time, and try to follow same time. Increase fluid intake appropriate for age, weight, unless contraindicated. Patients with cardiac and renal diagnosis may have a different fluid intake. Obtain LIP order for consultation with dietitian as necessary. I realize that an LPN does not obtain this order from the LIP, but you can notify the RN who can obtain that order from the LIP. And encourage diets high in bulk and fiber, and review food lists with patient. Consider patient's preferences. A nursing knowledge base, factors affecting bowel elimination. These are all factors that can affect bowel elimination. Many factors influence the process of bowel elimination. Knowledge of these factors helps to anticipate measures required to maintain a normal elimination pattern. Age influences bowel elimination. Older adults may have decreased chewing ability, peristalsis declines, and esophageal emptying slows. This impairs absorption by the intestinal mucosa. Muscle tone on the perineal floor and anal sphincter weaken and may cause difficulty in controlling defecation. Regular daily food intake helps maintain a regular pattern of peristalsis in the colon. Fiber in the diet provides the bulk in the fecal materials. Bulk forming foods help remove fats and waste products from the body. Some foods may also produce gas, which distends the intestinal wall and increases colonic motility. While individual fluid needs vary with the person, a fluid intake of 3 liters per day for men and 2.2 liters per day for women is recommended. Fluid liquefies intestinal contents by absorbing into the fiber from the diet and creating larger, softer stool masses. This increases peristalsis and promotes movement of stool through the colon. Physical activity promotes peristalsis, and prolonged emotional stress impairs the function of almost all body systems. During emotional stress, the digestive process is Accelerated and peristalsis is increased. Squatting is the normal position during defecation for the patient who is immobilized. In bed, defecation is also difficult. If the patient's condition permits, raise the head of the bed to assist the patient to a more normal sitting position on the bedpan, enhancing the ability to defecate. A number of conditions such as hemorrhoids, rectal surgery, and anal fissures, which are painful linear splits in the perineal area, and abdominal surgery result in discomfort. In these instances, the patient also suppresses the urge to defecate to avoid pain, contributing to the development of constipation. As pregnancy advances, this is the same case. Many medications prescribed for acute and chronic conditions have secondary effects on the person's bowel elimination patterns. Some medications are used primarily for their action on the bowel and will promote defecation, such as laxatives or cathartics or control diarrhea. Constipation is a symptom, not a disease, and there are many possible causes. Improper diet, reduced fluid intake, lack of exercise, and certain medications can cause constipation. When intestinal motility slows, the fecal mass becomes exposed over time to the intestinal wall, and most of the fecal water content is absorbed by the body. Little water is left to the stool and lubricant for the stool. Constipation is a significant source of discomfort, and the nurse should assess the need for intervention before the defecation becomes painful or the stool is impacted. Fecal impaction results from unrelieved constipation. In cases of severe impaction, the mass extends up into the sigmoid colon. If not resolved or removed, severe impaction can result in intestinal obstruction. Patients who are debilitated, confused, or unconscious are most at risk for impaction. The nurse should suspect an impaction when a continuous oozing of liquid stool occurs. The liquid portion of the feces located higher in the colon seeps around the impacted mass. Diarrhea is an increase in the number of stools and the passage of liquid unformed feces. Intestinal contents pass through the small and large intestine too quickly to allow for the usual absorption of fluid and nutrients. Irritation within the colon results in increased mucus secretion. As a result, feces become watery and the patient may have difficulty controlling the urge to defecate. Excess loss of colonic fluid can result in dehydration with fluid and electrolyte or acid-base imbalances if the fluid is not replaced. Meticulous skin care and containment of fecal drainage is necessary to prevent skin breakdown. Some causes of diarrhea include C. diff, communicable foodborne pathogens, surgeries or diagnostic testing of the lower intestinal tract, and food intolerances. Fecal incontinence is the inability to control passage of feces and gas from the anus. Many conditions cause fecal incontinence or diarrhea, and it is important to identify precipitating conditions and refer to healthcare providers for medication management. Hemorrhoids are dilated, engorged veins in the lining of the rectum and can be either external or internal. Increased venous pressure from straining at defecation, pregnancy or heart failure, and chronic liver disease cause hemorrhoids. Apply the nursing process and use a critical thinking approach in your care of the patient. The nursing process provides a clinical decision-making approach for you to develop and implement an individualized plan of care. During the assessment process, thoroughly assess each client and critically analyze findings to ensure you make client-centered clinical decisions required for safe nursing care. Consider all critical thinking elements that build towards making appropriate diagnosis. You are part of the eyes and ears for the RN. Make sure that if you notice when you are observing a patient or if a patient states to you that they are having an issue, that you notify the RN immediately. Patients expect the nurse to answer all of their questions regarding diagnostic tests and preparation for tests. And nursing history provides a review of the patient's usual bowel patterns and habits. Okay, you need to determine what their normal, usual elimination pattern is. Include frequency and time of day. Have the patient or caregiver complete a bowel elimination diary if necessary. Patients should describe their usual stool characteristics so you can see when there's something that is different from the norm. You should be able to identify routines followed to promote bowel elimination. Some people have bowel movements every day. Some people have bowel movements every 3 days. We notice that if they haven't had a bowel movement in 3 days, that they may be constipated, but that may be their usual bowel pattern. So you would need to know what that pattern is. You need to know if there's any presence or status of bowel diversions. Have they had any surgeries or issues where they may have a bowel diversion? And then any changes in appetite you should note. And what their emotional state is. Maybe they have diarrhea at this point because of their emotional state. What medications are they taking? Do they have a history of exercising and now they're not exercising because they are in our hospital? Do they have any pain or discomfort when they're having a bowel movement? All of these things need to be evaluated when taking care of a patient. A physical assessment, of course, would be looking into the mouth, listening to the abdomen, assessing all of these different things that could be going on. If you notice anything that you need to notify the nurse of, then please notify the nurse so that she can notify the LIP. Patients can also have goals and outcomes that they need to be following or moving towards having to do with their elimination patterns. Patient establishes a regular defecation schedule. Maybe you need the patient to be able to list proper foods and fluids that they need to take in. Maybe they need the exercise and you can get them on an exercise program. Maybe you need to inform that they need to notify the nurse if they are straining or having any discomfort when they are defecating. It takes a team approach to take care of our patients. It is not just the RN, it is not just the LPN, it is not just the CNAs, and it is not just the LIP. It takes all of us to care for our patients adequately. Successful nursing interventions improve the patient and family members' understanding of bowel elimination. One of the most important habits to teach regular bowel elimination habits is to take time for defecation. Don't rush your patients. Don't tell them that you're in a hurry or stand there by their side, tapping your foot, waiting for them to have a bowel movement. Give them the time and the privacy to do that and the dignity. There are a number of interventions that can stimulate defecation, which can help with peristalsis, and this can include ensuring that they have the privacy again, giving them fluids to drink, making sure they're sitting upright, and they're in the right position to have a bowel movement. Laxatives and cathartics have a short-term action of emptying the bowel. These agents are also used to cleanse a bowel for a person who's going through a GI test or abdominal surgery. If your patient has laxatives and they're refusing them, you would need to let the RN know so that they can be aware that they may become constipated. Many people who are on narcotics need to be on a laxative because they can be constipating. Also, anti-diarrheal agents, you want to ensure that you're monitoring how long that they have diarrhea, and when giving an agent to see if it actually resolves the problem. If not, they could have a medical condition such as Crohn's. They could have AIDS. They could have other things going on. There are times that we have to give enemas when it comes to our patients when they have not had a bowel movement for a certain amount of time so that they do not get impacted. The enema is an installation of solution into the rectum and sigmoid colon. Primary reason for an enema is to promote defecation by stimulating peristalsis. Excuse me. Cleansing enemas promote the complete evacuation from feces from the colon. This acts by stimulating peristalsis. The doctor will order the type of a solution to use for your enemas, whether it's a tap water enema, normal saline, hypertonic solution, or soap suds. These usually come in pre-solution containers, commercially prepared containers. Just remember that when you are pushing in the enema solution, that you don't let go of that pressure, otherwise you will suck the solution back up into the container. Sterile technique is not necessary when it comes to giving an enema. You are required to wear gloves, explain the procedure to the client, place them in a left sim position, precautions to avoid discomfort. If there is any pressure when inserting the tube into the rectum, make sure that you stop and assess the rectum to ensure that you are not causing any issues when going into the rectum. Also, ensure that they have enough time and all of their supplies when they are having a bowel movement after having an enema, because that pressure to evacuate that fluid is going to be sometimes hard for them to control, especially if they don't have that control. You are part of the bowel training process. Remember that ensuring that the CNAs and ensuring that you go in and offer the toilet at regular intervals will help your patient to have be successful in bowel retraining. Make sure that you are helping out with the diet and the fluids that they need so that they can be successful in this. Maintenance of proper fluids and food intake, promotion of regular exercise, and management of the patient and fecal incontinence of diarrhea, and maintenance of skin integrity. Develop a therapeutic relationship with your patient so they feel comfortable asking you when they have to go to the bathroom. Evaluate a patient's level of knowledge. If they don't understand, then you may have to change the way you are teaching them, and determine the extent to which the patient accomplishes normal defecation. Ask the patient to describe changes in diet, fluid, and activity to promote bowel health. I just want to remind you that they need to be in the left side laying position when you give an enema. I want to remind you that any patient with cardiac disease or is taking cardiac or hypertensive medications, make sure you obtain a pulse rate, because manipulation of the rectal tissue can stimulate the vagus nerve and sometimes cause a sudden decline in the pulse rate and can cause issues with their heart. If you have any questions, don't hesitate to contact the KDC, and we are here to help at any point. I hope that this helped you understand elimination a little bit better. I do believe you know what goes in must come out, and so monitoring of intake and output is important. Encouraging fluids, as I stated, is important. Giving medications as ordered by the LIP is important. Ensuring that your patient's mucous membranes are moist, that they have been taking in enough fluids is very important, especially when somebody's dehydrated. You can be that first line of defense in helping your patient to be successful in elimination. Thank you.